Thank you for joining the Sleep and Headache Chat with the National Headache Foundation. We're joined this evening by Dr. Stephen Poceta of the Scripps Clinic. Dr. Poceta?
I'm Dr. Steve Poceta. I'm a neurologist and sleep disorder specialist at Scripps Clinic in La Jolla, California. I've been in the field of neurology and sleep disorders since 1987 when I took this job. So I have a fairly broad, long experience in sleep disorders and neurology, and over time realized that sleep and headache were very much affected each other. And with time, others have noticed this, and we've tried to do some research and a little work in understanding the relationship of sleep and headache. However, it's not easy. Sleep itself has a wide variety of, shall we say, issues that make it hard to research. Our sleep need is not always known. Some people sleep better than others, but that's normal. Some people are sleepier than others, but that can be normal. Sometimes it's hard to define normal compared to a disease state for something that is basically a natural function, that is sleep. That makes it difficult. And then in addition, headache is a condition that's by its nature something that people only feel, and there isn't a lot of objective tests for it. Headache can be influenced by stress, by diet, by time of day, by hormones and menstrual periods, and so many, many things, that headache itself is also kind of a vague, hard to define thing sometimes in terms of what causes it. And in fact, headache is normal as well. Headache is a protective head pain that happens when we're sick and this sort of thing. So the fact that sleep and headache are both so hard to research makes it doubly hard to really be sure of the real relationship, cause and effect relationship of sleep and headache. There are a couple of things that are well known that I would call almost facts in this field of sleep and headache. One thing that is a well accepted fact is that sleep apnea can cause a type of headache. If sleep apnea is severe, people wake up with a migraine type headache. Another fact in this area is that sleep apnea can worsen migraine. So if a person has migraine headache or other kinds of headache, but mostly we talk about migraine, and the person also has sleep apnea, many times we find that treating the sleep apnea improves the frequency or the severity of the headache. So those two things about sleep apnea and headache are pretty well established. Another area that's well established has to do with cluster headache. Almost 80% of patients with cluster headache, who tend to be men, have sleep apnea. And so we know that anybody with cluster headache needs to be tested for sleep apnea. And many times, treatment of the sleep apnea helps the cluster condition. Many times not, but it's definitely a fact that there's some kind of connection between sleep apnea and cluster headache. Another very well established fact in this area is that patients with migraine have more complaints of sleep than people without migraine. People with migraine have a very high prevalence or a very high rate of various kinds of sleep complaints, be it trouble getting to sleep or staying asleep or waking up too early or being sleepy and tired in the day. So we know that patients with migraine have sleep disorders, but after that, it becomes really hard to say for sure, like in any one person, this sleep problem causes this amount of their headaches, or vice versa, that the people with headache cause sleep. It becomes really complicated to sort out the cause and effect. That said, nonetheless, everybody recognizes a relationship of sleep and headache. People often sleep off a headache. Some people have headaches that happen only when they are asleep. And as I said, people with headaches often have poor sleep. So with that as a very broad introduction, I'll be happy to entertain any questions.
The first question is from Stephanie, and she's asking, what do you recommend as a different treatment route for those with insomnia as well as those who experience headaches?
I would say that insomnia, difficulty getting to sleep or staying asleep, is the most common sleep problem that's seen in patients with headache. So insomnia is a symptom, and let's just say that if a person can't sleep, what the sleep doctor will try to do is find the underlying cause. Let's assume that the underlying cause is something fairly common like stress or work or worry or some anxiety. If the insomnia is due to something more serious like a bad depression or sleep apnea, then that needs to be treated. But many of us have plain old insomnia that I call it plain old insomnia or learned insomnia, and it's intermittent depending on our life situation. There's a pretty well-defined group of treatments for that. I would urge anybody with insomnia to take a little program that's on a website called CBT, Cognitive Behavioral Therapy, cbtforinsomnia.com. This is a small fee, a commercial site. It's made by a doctor in Massachusetts who gathered all the information we know about how to sleep better without pills, and he put it into this 5-week training program. It's a very well-established program in our field. It's not like Dr. X's secret potion. It's really what we know that you can do to sleep better, such as setting a regular morning wake-up time. I emphasize the wake-up time, not the bedtime. Getting some degree of morning light and exercise is often very important. Some kind of stress reduction technique is important. Progressive relaxation, meditation, prayer, yoga, whatever appeals to you to try and manage life stress and manage the anxiety that comes with that. In general, we recommend people with insomnia decrease their time in bed, not increase. So if you're only sleeping 5-6 hours, you don't want to be in bed for 8 hours. It leads to more frustration. So those are some of the behavioral approaches to insomnia, and you can get a lot more detail on that website, cbtforinsomnia.com, Dr. Greg Jacobs in Massachusetts. Of course, sleeping medicines are often used, and they all have their pros and cons, from ambien and lunesta to amitriptyline, and I'll save a detailed discussion of that till I see some other questions.
Our question from Anchor in New York. I wake up in the morning with headaches and I often have neck pain. I've changed my pillows and mattress. Do you have any suggestions on the best sleeping positions that will help?
When headaches are related to the neck, I agree with you. It's really important to have the pillow and the mattress be right. In general, I'm not a big fan of this or that kind of mattress. I don't recommend one over the other. But for people with sort of neck tension, neck pain, the sleeping position is important. You can try wearing a collar, or in general the best pillows are those that support the neck, the kind like with the bump, the hump, the Tempur-Pedic foam, where the support is mainly on the neck and not on the head. You want to keep the neck, shoulders, and head aligned. It might not all be in the sleep though, because your posture in the day and the neck tension during the day is also important, and so visiting and making sure you're stretched appropriately and your posture is good and you're doing those kind of things can help with the nighttime neck pain as well. I can't imagine sleeping on the floor would be good for you. Sometimes people who snore heavily or have sleep apnea extend their head or lift their head up on their neck, and that can lead to pain. So if you snore, get that checked out.
Our next question comes from Sherry. I have had a constant chronic headache for 32 years, plus migraines 2 days out of the week. I can't sleep more than 4 hours a night. I'm on a CPAP machine, but it hasn't helped much. If I sleep longer, my head is much better when I wake up. What would you suggest to help with my sleep?
Well, this question illustrates several interesting things. One is that we believe that snoring and sleep apnea are conditions that lead people to go from having occasional headaches to chronic headaches. So it's another reason to check out snoring and sleep apnea and get it treated if you can. There's nothing about sleeping 4 hours a night that has anything to do with obstructive sleep apnea. So you may have obstructive sleep apnea and you may need CPAP, of course, but sleeping 4 hours a night is not really a symptom of sleep apnea. So you have a separate condition, an insomnia type condition, that should be approached and treated by your doctor, maybe with the behavioral techniques I've already mentioned, but in addition, probably you need medications, and there are a lot of headache medications that promote sleep, and of course the primary sleeping pills, some of which I've mentioned. But it's a good sign that you at least have found that when you sleep better, your headache is better. And so doing what you can to lengthen that sleep, yes, the CPAP machine is important, the mask fit, but the behavioral methods I mentioned, and then it sounds like you might be somebody that where a sleeping type pill might be helpful.
Our next question, what are some complications of sleeping off headaches?
I'm not really aware of any. It's extremely common in children who have shorter migraines in general than adults, that they sleep as part of the resolution of the headache. And it's been described for many years that yawning and fatigue herald the beginning of a migraine in some people, and then the migraine resolves after a nap or an overnight sleep.
Our question from Sue in Kansas. Is there any information on the use of ambien? For example, has it been known to positively impact migraines in the long term? After chronic insomnia for 17 years, I was put on ambien. I now get sleep, but I have not seen much change in the frequency or severity of my headaches.
Sue, that's a really good question and a really good observation. And unfortunately, it illustrates one of the things that I was saying earlier in my introduction. We know there's a connection between sleep and headaches, but it's not a simple connection. If it was simple, then people who have bad sleep and headaches, we could give them ambien, they'd sleep better, and their headaches would get better. But you're illustrating that even though you have a sleep disorder and have treated it with ambien and you sleep, there's not much change in your headaches. And I'm sorry to say that that's not an uncommon experience. That's fairly common experience. That I don't mean to be pessimistic about it. You need to keep trying. Maybe ambien isn't the best one. Maybe a different one would be good. Maybe there's something else about your sleep, why your sleep is bad, why you need ambien. Treat that stuff, get off the ambien, and your headaches might get better, if you see what I mean. If you, again, go to that website, cbt4insomnia.com, take the course. That's your best chance of getting off the sleeping pill and sleeping at least somewhat. So another way of saying what I just said is, like, even if sleep and headache are related, maybe the ambien is just putting you to sleep and sort of treating the symptom, not really getting at the underlying cause. So the behavioral programs are better for that.
Is there a link between sleep, underactive thyroid, and migraines? If so, what would you recommend to someone who has thyroid disease and migraine?
Well, I don't have a clear-cut answer for you on that one either. I'm sorry. Everybody's asking me tough questions. But thyroid affects sleep. Thyroid affects migraines. Most doctors believe that the thyroid can be adjusted fairly easily, fairly readily, with medicines and with monitoring by blood tests. Now, some doctors believe that there are subtleties to that, and that there are people who will do better when their thyroid tests are a little out of the normal range, or a little higher or a little lower, what have you. But in general, if your thyroid is thought to be normal by your doctor, in general, most people believe then that the thyroid is not the problem with your sleep or your migraines. That being said, if you're not sure, you might ask your doctor for a second opinion from an endocrinologist. You got to be a little bit careful with thyroid. It is one of those things where people sometimes feel better on thyroid medications, but there are some serious side effects. So it's kind of a controversial area. But in general, what I said is true. If your thyroid tests are normal and your doctor's happy with your thyroid, thyroid is probably not the cause of the sleep problem and the migraine problem. Now, with one thing about sleep that's weird is that people might get into a phase of bad sleep. They're stressed out, or they have a life crisis or a death of some friend or a loved one, or loss of a job, and they go into a phase of bad sleep. And that's kind of normal. We all know that we don't sleep well when we're grieving or upset. But then what happens to some people is, over the months and years after the stress is better, but they still can't sleep. And what we believe has happened in that case is that the brain has become conditioned to not sleep when the person is lying in bed and trying to sleep. That the person's brain has gotten in the habit of being hyper or aroused or unable to sleep during the time when they used to be able to close their eyes and lie down and fall asleep. So it's like there's a bad connection now between trying to fall asleep and lying in bed and the ability of the brain to turn off. So even though if you had a bad thyroid at one point and you had bad sleep, your thyroid might be better now, but you've now got this so-called learned insomnia or conditioned insomnia that persists, and that's the kind of thing that the program I was talking about can help you with.
Our next question is from Karen in Michigan. I can't seem to take a nap without waking up with a headache. I'm a migraine sufferer, but these headaches don't start as migraines. Any suggestions?
Well, that's kind of an interesting thing. I mean, I don't know why a nap would trigger a headache, especially if you don't get a headache when you sleep overnight. Now, you could ask yourself, why do you need a nap? Maybe you're just a person that maybe you live in Mexico and you're taking a siesta. I don't know. But if you feel the need to take a nap, I mean, everybody might take a nap occasionally. But if you feel the need or a strong need to nap every day, then you might not be getting good sleep at night. Naps are best taken at the siesta phase, which is generally measured to be 8 hours after the wake-up time. So if you're somebody who sleeps from 10 p.m. to 6 a.m., your body's natural clock will put you in nap mode at about 2 p.m. I recommend that that's the only time people nap, 8 hours after their regular morning wake-up time, and that they nap for 30 minutes or so. That's in the normal phase. Now, if you didn't sleep at all the night before because your kids stayed out late or whatever and you got to take a longer nap, that's different. But in general, I recommend up to a 30-minute nap and only at that time. So if you're napping at other times, you're going to interfere with your sleep, but otherwise I can't really think of a direct reason for nap causing headaches.
Our next question is from Colleen in South Carolina. For the past 2 weeks, every night before I go to bed and when I wake up, I have a headache, sometimes with nausea and other times it's with nausea and dizziness. I do suffer from migraines and seasonal allergies. Could this be the reason? Also, I never snort before and now I do. What would cause this change?
Well, I'm always amazed at how treating allergies can improve sleep and can improve headache. I never snort and now I do. That could be because of nasal allergies or congestion have caused the nose to get a little more stuffed up, and then now you're snoring, so the quality of your sleep is not as good. And as I said, we know that poor quality sleep can increase the likelihood of headaches. So I don't know. I think you've answered your own question to me. Everything you've said fits. The season has changed, and you've now got some allergies, or maybe now there's dust in the room or something, and that might be the recommendation.
If someone is having sleep issues and suffers from insomnia, what type of specialist would you recommend as a first step?
Well, I'll tell you. I mean, one of the reasons I'm on this call is that not many people do both things. And so we have a headache center here with 3 doctors, and I've been in sleep for a long time, and so we're very keen and sensitive to the role of sleep in headaches, but it isn't something that is real common. So your primary doctor, of course, is good to get a start with a recommendation, because that doctor would know which neurologist might be most interested in your headaches, number one. If you go to the sleep place first, you basically are going to be getting a sleep test and then maybe some kind of therapy depending on what the sleep test might show. So unfortunately, doctors are like anybody. They kind of do what they know how to do, and it's hard for them to do other things. So a lot of headache doctors don't know much about sleep, but they might send you to a sleep person, and I would go that way. I mean, I'd go primary, neurologist, and then sleep therapy as at last.
Our next question from Sherry in Montana. All sleeping pills make my headaches worse. What else would help?
Well, you might want to get a study on CPAP and a sleeping pill to see why that would be. Many medicines do make headaches worse, no doubt about that. There's an awful lot of sleeping pills, and there are also antidepressants that can be sedating and act like sleeping pills. So in terms of what else would help, I don't want to come across as a pill pusher. The program I mentioned earlier is the best way I know to be able to sleep or sleep somewhat better without resorting only to sleeping pills.
Our next question is from Rosalie in Washington. I've been diagnosed with hypnic headaches. Caffeine seems to be helping. What information do you have about this condition? I also have chronic migraines.
Congratulations, that's great. That is not a common diagnosis, so you're going to a good doctor. Okay, well, to me, hypnic headache is what we call a diagnosis of exclusion, and so for people whose headaches are clearly linked to sleep, let me say that a little bit different way. For people whose headaches are clearly almost always happen out of sleep, or mostly happen out of sleep. They've been asleep and they wake up with the headache, even if it's morning, but especially if it's in the middle of the night. Those people I very often get a sleep study on. I'm not really comfortable diagnosing hypnic headache without a sleep study. There's at least 2 or 3 studies that things can look just like hypnic headaches, but it turns out the person's really having sleep apnea or very poor quality sleep, and that's where the focus should be. So that's one caveat I have about the diagnosis of hypnic headaches. Caffeine helping definitely, though, does fit with the diagnosis. I don't have a lot of information on hypnic headaches. They probably mostly happen out of REM sleep. There's some kind of alteration in the nervous system. They do tend to be more in older people, and unfortunately that means if you're older, you're also more likely to have other conditions. So I'm never totally comfortable with the diagnosis. I'm always looking for something that I can treat more specifically.
Are there problems with sleep and traumatic brain injuries? If so, what are the common problems and how can one get their body back to normal sleep patterns?
Yes, there's a broad number of experience with traumatic brain injuries and sleep problems. There's no question about that. Depending on the severity of the head injury, the sleep problems are different types. In fact, mild traumatic brain injury with a reasonably good recovery, it actually is associated with more depression and more sleep problems than some of the more severe head injuries are. But head injuries that are bad enough to cause chronic headache, for example, pain, anxiety issues, depression, are also those that are more likely to cause sleep problems. And we don't really have specific therapy for that kind of headache. Instead, we have to, like I was saying earlier, sort of take the 2 things separately and treat the sleep specifically or separately from the head injury. That might mean medicines or treating sleep apnea, or if the problem with the traumatic brain injury is being too sleepy in the day, then there are some studies that have shown treatment with stimulants like New Vigil can be helpful. So there are often problems with sleep disorder in traumatic brain injury patients who have recovered.
Our next question from Susan. I'm 61 and I've had migraines since I was 7. I recently did a sleep study and I was given a CPAP machine. I tried to use it and I thought my head was going to blow off my shoulders. Are there people with migraines who cannot use a CPAP?
Well, there are people who cannot use CPAP. We believe that the way CPAP is adjusted, the pressure settings, the type of CPAP, and the way you're taught to use it make a difference in your ability to use it medium and long term. What's commonly done is this. Person snores, they get a sleep study, a technician adjusts the CPAP in the night to what looks like the right pressure. Then the person sees a doctor, maybe a sleep doctor, maybe not, and the doctor writes a prescription for the CPAP machine at a pressure determined by the technician in the night. Well, sometimes that pressure isn't tolerated by the person. The technician might have looked like you needed, let's say, a pressure of 12, but then now the next day you wake up and you put the mask on and that pressure of 12 is just too much for you and you can't tolerate it. So in that case, the sleep study really didn't do you any good. So when you say the CPAP machine was blowing my head off, that tells me that the pressure was set either too high or in a way that wasn't easy for you to tolerate, and of course you're not going to be able to use it. So you got to go back to the sleep center, back to the doctor, and say, something's got to be different here. Sometimes the different mask will be helpful. Sometimes there's something called bi-level CPAP that allows the machine to be adjusted so the pressure is less when you exhale. So BiPAP is much more comfortable for people. And then there's a couple other little adjustments on the machine. But you got to be able to tolerate it with it on. Now that having been said, Susan, I mean, the sleep apnea is not the cause of your migraines since age 7. So you're another example of somebody that's got two conditions. Now, I don't mean to be discouraging, but I would definitely try a different CPAP setting or talk to somebody that can adjust it and see if you can get to use it. It might help your headaches now, but again, it is not going to be the cause of your headaches. I know you didn't think it was anyway.
Our next question is from Sue in Kansas. Can you comment on why so many migraines seem to start during sleep, especially in the hours of 3 a.m. to 5 a.m. for me? I often go to sleep feeling fine, and then I wake up feeling like a sledgehammer hit me during sleep.
Okay. Well, we used to think that was because the REM sleep was the sleep stage where migraines mostly started. And that might still be true. Certainly we do know that REM sleep is the stage that's most dominant in the last half of the night. So REM sleep is a stage of some autonomic instability, more swings in blood pressure, and we've always thought that that was going to trigger migraine. So that might be why. Now also though, when people say that, I think or wonder maybe they're having caffeine withdrawal and your morning caffeine is wearing off at 3, 4 a.m. And so I often think about caffeine withdrawal in people with the pattern that you described. And when the nausea is severe when you wake up, you really got to blast yourself with your treatments, your anti-nausea treatments, maybe even a suppository. And that's when the injectable migraine therapies are more likely to be effective.
Our question from David in Maine. I note that when I have a slight headache in the morning, it will sometimes clear when I sit vertically after a while. Sometimes this headache will evolve into a migraine, but generally, is it possible that there is a difference between lying horizontally and sitting vertically? Can fluid pressure build up into the head, which can clear when sitting vertically after some time?
The way we understand it is the answer is generally no. The way we understand how the brain works, you see the brain is kind of floating in spinal fluid that surrounds it. So the brain is kind of like a ball or something in an aquarium. So more fluid up there wouldn't cause headache. Well, I mean, except if there's a brain tumor or something really serious, yeah, but that wouldn't go away when you sit up. So in general, going from lying to sitting usually makes headache worse. Now, the only thing I can think of though, not fluid pressure buildup in the head. No, I can't imagine how that could be, although maybe sinuses if you tell me it's sinus, okay. But the thing I'm thinking of is your neck. So you're lying or sleeping in a certain position with a certain pillow or what have you, and you sit up, and then that changes your neck position, and so your headache gets better after a while. That seems more logical to me. But I mean, I have a slight headache often in the morning until I get my first cup of coffee, but I think you're talking about position change.
Our next question is from Lori. Do you think that not sleeping deeply and soundly causes headache? I don't have sleep apnea, and if I wasn't on Lunesta, I wouldn't sleep during the night.
So again, I think that bad sleep makes people tired, and that can contribute to headache. Bad sleep definitely changes brain chemistry, and that can contribute to headache. So yes, I do think that poor sleep can contribute to headache. Well, no, we do know that if you take a person and they constantly are awake and you sleep deprive them for 1 or 2 days, there is a headache that happens in those people. And so, yeah, that kind of headache, we call that sleep deprivation headache. The deep sleep and the sound sleep, I do think, yeah, they can contribute to headache. It doesn't have to be sleep apnea. It can be chemical. And I'm glad that the Lunesta is helping. But as I said earlier, I still try to advise people that being on sleeping pills is not necessarily the best thing long term. And if you can learn some behavioral techniques and gradually cut that Lunesta down, that would generally be best for you. Lunesta comes in milligram strengths 1, 2, and 3, so there is some flexibility in trying to try some behavioral techniques on that website I mentioned, cbtforinsomnia.com, and then see if you can even begin to reduce it just by a little bit on certain nights of the week. Okay, I was wondering, what is your take on alternative treatment for sleep-related headaches, example, acupuncture? I don't have a take on it, but I'll just give you the pros and cons of these things. So on the one hand, I'm kind of a scientist, and I like there to be scientific evidence and studies for the treatments that I recommend. So for sleep, that's melatonin, valerian, GABA powder. Those things are reasonable, mild sedatives. There isn't a lot on acupuncture, chiropractic. There's not a lot of studies on that. I happen to be sort of a believer, you could say, in acupuncture. But when you're doing something that isn't very proven, what you're really doing is kind of taking a gamble. And some people can afford to gamble and some can't. There's a financial element to it. There's also a risk element to it. Acupuncture is pretty safe, so in the worst case, you might be wasting your money. But other treatments, there are alternative treatment centers that are very aggressive with intravenous infusions and things like that. And that's where I really do worry that the gamble is not in your odds of winning. We have an acupuncture center here. Several doctors do acupuncture, and it really is an accepted therapy for a lot of things like stress and pain. And so it really ought to be helpful for sleep. I got no problem with it.
Our next question comes from Lisa. She has suffered from chronic daily headaches for 20 years, and she'd like to know, does shallow breathing contribute to that?
Well, I don't know why you wonder if you don't breathe at night. I mean, you must be having some kind of sensation maybe of, now when people do drift off to sleep, there's a change in the state of the brain from waking to stage 1. It's a very clearly defined event. And the brain monitoring system of our gases, oxygen and carbon dioxide, changes. And so it's very common not to breathe in the first like 10, 15 seconds of falling asleep. And so how you sometimes get that twitch then in that phase of falling asleep. Many times people have a feeling that they weren't breathing at that time as well, and it's true. So sometimes it can be difficult to get past that first 10 to 20 seconds because of this natural shallowness of breathing. If you're overweight significantly, then you should be tested for your oxygen levels, because even without sleep apnea, obesity can cause low oxygen in the night, and maybe that's what you're kind of sensing. But it's not common in my experience for headache and sleep people to really have a feeling that they're not breathing at night. It's a little bit of an unusual symptom. Okay.
Our next question, is there any evidence that proves migraine sufferers react differently to sleep medication? I take ambien regularly, but I'm perplexed as to why it takes so long to take effect while others fall asleep within 15 minutes.
No, there is not. But I don't think it's because you're a migraine sufferer. But honestly, there is no study that I'm aware of that's ever looked at the effect of medicine A or B on migraine people compared to non-migraine people in this. But here's the thing about sleeping pills. They only work, or they work best, when they're taken at about the time you're going to normally sleep anyway. And this is why the schedule is so important, the regular schedule. Not really the regular bedtime, but the regular wake-up time is critically important. People with sleep problems should be getting up at the same time every day, ideally a little earlier than they naturally would wake up. So if you're having trouble on and off with sleep and you're waking up at 6:30 and getting up, I tell people set that alarm for 6, force yourself up at 6 even though you got a bad night's sleep. After several days, your body clock begins to use 6 a.m. as your wake-up time, or whatever time it is. I don't care. It could be 6, could be 8. Hopefully you're getting a little sunlight and exercise in the morning. So now you're kind of doing your best there to set your clock for a 6 a.m. wake-up time, and everything follows from that. The nap 8 hours later, that's the time that it's good to take a nap. The falling asleep time is going to be 16 to 18 hours later. That means your wake-up time is at 6, then your earliest time you're going to fall asleep is around 10 p.m. For many people, it's going to be midnight. A lot of people, for whatever reasons, really can only sleep 6 hours. Let's call it 7. Let's call it 7. So if your wake-up time is 6, you shouldn't be taking your ambien till 11. And then you take your ambien, you get in bed, and you hopefully fall asleep. The main reason that I see people who say the ambien doesn't work is that they're taking it too early. And if I took an ambien or you took an ambien at noon, you wouldn't really expect it. Well, maybe you would, but I'm going to tell you. Sleeping pills work best when you take them at the time your body is sort of, quote, ready and naturally going to go to sleep anyway. The sleeping pills only cause side effects if you take them when you're otherwise going to be awake. So if you imagine yourself taking a sleeping pill at noon, I think there are people who believe, oh, I took a sleeping pill, it's going to knock me out. Usually that doesn't happen. Usually you just get inebriated or impaired or drunk, or maybe you do sleep for a couple hours. But I hope that answers your questions. I think it's possible that you're taking your ambien a little bit too early, or maybe your dose isn't strong enough.
Our next question. I've been in a sleep study twice, and I just received a new CPAP machine. My headaches have not subsided. In fact, they've become worse. I also just got a new auto machine. Would that help?
Okay. The auto machine, auto PAP, is a really nice machine for some people because it will adjust the pressure up and down in the night as needed. And if your sleep apnea is severe, that's the kind of person where the auto PAP is generally pretty effective. The auto PAP is not so great for mild sleep apnea for various reasons because the machine's got a sensor in it, and it's got to sense if you're having an apnea or not. So having severe apnea makes it easier for the machine to do its job. Your pressure over the course of the entire night will probably be a little lower, especially if your sleep apnea is positional. So like you have worse sleep apnea when you're on your back than you're on your side. The auto PAP is good for that. Now, I was talking earlier about the combination of sleep apnea and insomnia. And so you might have bad sleep from another reason that doesn't have anything necessarily to do directly with the sleep apnea. So if you take a normal person and you make them wear CPAP, you can imagine they're going to not sleep as well. I mean, if I had to sleep with a CPAP mask on, I wouldn't sleep as well as without it because I don't have sleep apnea. But most people, if they have sleep apnea, now they sleep with the CPAP mask on, they sleep better, lots better, but they might not sleep still perfectly normal. I don't know if that's the case for you. It does sound like there might be some issues with the proper CPAP setting. If the doctor has now switched you to auto PAP, maybe they weren't sure really which setting was best, or your body doesn't react quite perfectly to the CPAP, and so your sleep apnea is only partially treated. So I'm not sure whether your sleep apnea is inadequately treated with the CPAP, be it because of the machine or because of the way your body is, or if you have a separate condition that's making the sleep poor. There are doctors who combine CPAP treatment with sleeping pills. And we don't do it routinely or on everybody, but it's possible that combining a sleeping pill, unless you're the person who said sleeping pill, all sleeping pills worsen my headaches. Yeah, I think you are the person who said that. So it does sound like people have tried a number of things, and you need to keep trying. If you haven't done the behavioral thing and kept your schedule as good as possible, please consider doing that.
Our next question comes from Marcia. One of the signs that I'm getting a migraine is that I sleep a lot the day before. I'm not lacking sleep. This is just a sign of a migraine coming on. Is there a reason for this?
Yes, we think, and I mentioned it earlier about fatigue and yawning, usually, not usually, but often being a prodrome for a migraine. We think of that as being a couple hours, not the whole day. But the women with menstrual migraine who are listening, they might realize that really the processes in the body, the hormone changes leading up to the migraine, can be a day or two in the making. It's certainly true for people who have what we call letdown headaches. Stressful Monday, stressful Tuesday, stressful Wednesday, and then you don't really get the headache till Friday evening when you're relaxing. And so it's like all those days led up to the onset of the migraine. It's interesting because there's a study in children that showed the day before a migraine, their sleep was worse. Their quality of sleep was worse the day before the migraine. And so the debate is did the migraine happen because the sleep was worse, or was the migraine beginning 24 hours before, and that worsened the sleep, or in your case, made you tired in the day? I kind of favor that. I kind of favor that the migraine process in some people is really a 24-hour onset of prodrome before they get the headache.
Our next question comes from Raymond. For the first half of my migraine history, almost all of my headaches have started during sleep. Once during a full instrumented sleep study with no obvious data disturbance. I do have sleep apnea, and I'm CPAP compliant. Lately, the onset profile flipped, and almost all of my headaches have started while awake. This was the phase of increased intensity and frequency. Do you think the sleep component was incidental?
I hate, this is the problem. I would love talking about sleep and headache, but I wish I knew something about it or something that explains some of these things, because we really don't know why some people have headache more often during sleep. Other people have headache more often in the afternoon. We just do not understand why that is. As I said at the beginning, we have a few facts mostly related to sleep apnea, but a lot of this stuff remains unexplained. Now, it would be interesting in your case to speculate that you had sleep apnea, even mild, maybe you were just a heavy snorer for years, and that triggered, that triggered some of your sleep-related headaches early on, and now that the sleep apnea is treated with CPAP, the headaches have switched over to be only in the day because your sleep quality is better. It's an interesting speculation, but I don't really know. And it's sad that your headaches are worse now that you're on the CPAP. So it could really be in your case that you got sleep apnea and you've got headaches and they're unrelated. I mean, Ray, you're probably a man with a name like Ray. So your chances, if you're between 30 and 60, your chances of having sleep apnea, depending on how you define it, are between 9 and 22%. So sleep apnea is so common, and it might be, as you call it, an incidental relationship between the sleep apnea and the headache. I mean, women will tell you that their headaches when they were in their 20s had this sort of pattern, and in the 40s had that sort of pattern, and now at menopausal another pattern, and now postmenopausal yet another pattern. And so it might be even in your case that the kind of changes that have happened with age have affected the timing of your headaches to go from sleep mostly to wake mostly.
Our next question comes from Lisa. My headaches get much worse when I lie down, so I cannot sleep off a headache. Is this very uncommon?
It's a little uncommon. most people with migraine don't like to move. And so the easiest way to not move is to lie down. And they seek relief in sleep. So you can't do that. And what I'm curious about is whether you not only can't lie down, but whether you actually wish to move around and pace around. That's very unusual for migraine, but very typical of cluster headache, where people don't like to lie down and they actually prefer to pace around and move around and even hit their head kind of because it's hurting so bad. So I am going to think about what you asked, Lisa, why that might be that you can't lie down. Now, going back to an earlier caller, when we do lie down, there is an increase in venous pressure in the head. When we're standing up, the blood is flowing out of our brain down through the veins of the neck, and it's got gravity on its side. So the venous pressure is extremely low, and that tends to keep some of the fluid sort of cavities, the venous areas with less blood in them. Now when we do lie down, venous pressure does go up a little bit. And so maybe that would be a mechanism by which headache could get worse if you lie down during the headache, when the meninges, where the veins, some of the veins are very hypersensitized already. So a little bit unusual, Lisa, but maybe we're going to learn something from you.
Our next question comes from Carol. Like others, I often wake up with a migraine. So if I think I might wake up with one, I take a sumatriptan at bedtime. It usually helps me wake up headache-free, but that can't be a good idea as a regular habit. You've been talking about sleeping aids like ambien. Do you recommend that instead of sumatriptan?
When people can predict when their headaches are going to happen, I think it's great to take a triptan such as sumatriptan or naratriptan or frovatriptan. I'll come back to why I say those in a minute. I think it's a great idea for people who think they're going to be getting a migraine with a high chance of success to pre-treat with a triptan. I recommend it in athletes sometimes. I often recommend it in women who know they're going to get a headache during their menstrual period. The better drugs might not be sumatriptan, though sumatriptan is one of the fastest in and fastest out medications. So it kind of peaks in the blood at, call it 90 minutes, and then it begins to get out of the body quite rapidly over just a few hours. And so depending on the timing of your sleep and the timing of your headache, a medicine like Relpax or Emerge or Frova might be a little more logical, because those medicines are going to be kind of, shall we say, effective in your body or in the blood for, call it like 6-8 hours rather than 2 to 6 hours with the Imitrex. So if you don't know when the headache's coming, in other words, it's kind of better to hit it with a shotgun, a broader, a longer acting medicine than such a short one as sumatriptan. But your logic is sound. Now, is it a good idea? It's fine if you're not doing it very often. And so sumatriptan should not be used more than, depending on who you are, 8 to 10 times a month, twice a week. And so using sumatriptan more often than that is not a good idea for health reasons, but also for rebound headache. So if you're taking it every night at bedtime, that's not good. But if you're taking it occasionally at bedtime, I think you've discovered kind of a good idea. It's a lot better than waiting till the headache is full-blown and then having to inject sumatriptan during a terrible headache in the middle of the night. No, Carol, regarding your other question, sleeping aids like Ambien, would that be better? No, I really don't think so. I mean, I'm happy to have you try Ambien and see if it prevents a headache, but in general, we wouldn't really. I'm not sure that your headache is being caused by bad sleep. And I mean, if you want to try Ambien, fine, but I don't see an advantage of that. I think you've got a really good, safe thing here that you're doing. And Ambien and all the sleeping pills, might have some degree of dependency and tolerance. They're habit forming, in other words. Even though Ambien's kind of famous for not being habit forming, it still is a drug with evidence for some dependency, and I have seen in my career a couple of people truly hooked on Ambien. So if you don't feel the need to go to Ambien for your sleep problem, I certainly wouldn't do it for the problem that you have just described.
Our next question from Jamie. I've tried melatonin and it actually worsens my sleep. I woke up even more throughout the night than I normally do. I've tried Ambien and Ambien CR, and now my doctor has me trying trazodone. Are there other, preferably more natural treatments you can suggest?
Well, I am a sort of a natural guy, and I like that stuff. And so the timing you wake up, getting morning light, really important. A total time in bed of, let's call it 7 hours, 6 to 7 hours. All that's natural. And I'll tell you another thing. It's natural to sleep poorly too. So the idea that we all sleep like a rock for 6 to 8 hours is not true. I did mention valerian. Now the melatonin is a little bit interesting. Most people take 3 milligrams right at bedtime. You might try like a ½ milligram more like at dinner time. And by dinner time I mean like 6 p.m. and at bedtime I mean 10 or 11. And it's possible that like a ½ milligram early will help you sleep later that night. It's kind of a long story and why that might be. We're in the final 4 minutes. If there's a question I've missed, I'd appreciate somebody calling it to my attention so I can try to do that. Otherwise, I'll take this opportunity to say that I really enjoyed this more than I thought I would. I hope that some of the things I said were helpful to you, and that I hope that they were helpful. I really appreciate everybody coming in and asking me these questions. I always learn a lot from it.
All right, we'd like to thank you for joining us today, Dr. Poceta. These questions were great. You did great with the answers. From all the responses, everyone is saying thank you.
Oh, good.
Yes, this is a very good session, and we'd like to have you come back again if you'd like.
I'll be happy to do it.
All right, well, that will conclude our session, everyone. Please join us again for the next sleep and headache chat in the future. And I hope everyone has a great evening.
Thank you.
All right, have a good night.